So I had started urine therapy from 1985 when I was 37 years, and I took two small breaks because of my professional and academic requirements, because I was in hostels and I was in such a professional environment where I could not have urine therapy administered. I started urine therapy for curing my leukoderma or vitiligo, where the skin loses its pigmentation. And it was a very, painful journey which I and my parents went through over 2 to 3 decades, because it was a very slow depigmentation. And let me tell you, for any vitiligo or depigmentation person, he will go through a lot of stigma, and what he would pray is a uniform color or monochrome color in his exposed body parts at least. So luckily, after administering urine therapy, I don't say that I got the entire pigmentation back, but it became some sort of a different type of pigment, where it is very, very light pigment. I don't have any contrast between black and white now. Very pleasing color, very monochrome, and I'm very happy about it. And also, what other people experience is the sunburn when they're exposed to the sun. Even if it's for 10 minutes, they can't expose to the sun. Those problems I am not facing. Of course, I also get sunburn, but my retention time in sun is a little bit very high. I can withstand even 2 hours of sun, hot sun. Okay. So with all these, that is the motivation with which I started administering urine therapy. I have, in last 10 years, I can say that I am maintaining very good consistency. I have not broken even for more than 2 days continuously wherever I am. So be it train journey or be it whatever, abroad or wherever I am, I have been having urine therapy, mostly drinking. And now I feel, the drinking, it has reached so many years now. I don't even feel like, no necessity of applying on the skin, because the skin is so good, so lustrous, no infection, nothing. So I save time in massaging also. Okay, so no need for application on skin, and no need for me to take any enema or so, because I do every Monday is my upwas. Today is my complete Shivambu upwas. Every week 1 day I do upwas, so no need for enema. My stomach gets cleaned automatically, so by Tuesday I am in heaven. Okay, so every week upas is a very great thing to do. All this protocol I established for myself. So it is not taking any toll on my time management, or even for my social engagements or commitments also, because as I say, it's just drinking my urine in the morning, and sometime if I feel, I will drink sometime another time in the day. Otherwise, on Monday, I drink whole urine, like that. And that has been my protocol. And I don't feel like, and I don't feel any need to massage. And then I wash my eyes with urine. So that's how in my late 40s, I'm now 47, finished. Doctor has prescribed lens, but still I am managing it without lens. Okay. And other good thing is, let me tell you, I had a very, I should say, tryst, or very much with this sugar and BP. Thanks to my familial history or whatever. So initially, it was not coming down. I was facing many issues, and I also asked myself, is urine therapy effective in curing these lifestyle disorders? And working in IT industry, a sedentary life, that also aided and abetted these hypertension and BP, along with my family issues. Okay, so it took more than 10-12 years. I was in pre-diabetic and also in diabetic range. Also hypertension was also like that. But let me tell you, when I started combining this with yoga and pranayama, and the consistency with which I administer yoga and pranayama increased, then slowly these parameters came to the normalcy. Okay, I can tell that now I'm having a good fasting readings. I'm having fairly okay BP readings because I used to have very high readings and now it is fairly okay. And I'm not taking any medicines for that. So, and it has been a very long journey. Let me tell you my experiences. It has been a quite long journey to control BP and sugar with autourine therapy. So unless otherwise, I use this yoga and pranayama only with thought urine therapy. I felt it is not so effective in tackling these lifestyle disorders. I will talk in detail why it is so. Some theoretization of that I will talk in next couple of minutes. So overall, one good thing I can share with you from my experience is, you might have seen many people talking urine as a panacea. It will solve all issues, kind of thing. But I am sounding here, and I'm giving you a very balanced picture. Okay, urine is beneficial, but it is not panacea. If we are abusing our body, then definitely, there is a limitation for the effectiveness of urine. Okay, so of course, some disclaimers: there is no conflict of interest, and I don't take any money or whatsoever for any suggestions or for any of the sessions. Okay, and my main aim is to crack the shell of ignorance which are there within all our social media, and there are vested interests who would not want free flow of knowledge. Okay. Uh, is urine a medicine, and is autourine therapy beneficial? See, our experiences talk that and show that many of our experiences. However, if somebody asks this question and if you have to scientifically answer, we can talk from our experiences, from our emotions, we can talk. But I think we need to have more and more scientific literature to unequivocally establish this evidence. Okay. So we are seeing there are, a lot of stigma in the society, and there are many vested interest groups which are not allowing the free flow of knowledge. Okay, in those background, the onus on we autourine therapy advocates, autourine therapy ambassadors is very high because we have to tackle all these issues and navigate our journey forward. So because of these, stigmas and the vested interests, what these vested interests are doing is, I will show in my following slides, picking up a few, basing my analysis on few scientific studies, that most of the public are subjected to ignorance. Okay. So this ignorance is that, urine is not medicine, or it will create side effects, kind of thing. You should, there are no scientific evidence. All those ignorant narratives have been projected in the media for decades together. So we have to share that knowledge, our experiences, because knowledge is the liberating factor. And through that only, oh my God, again admitting, through that only we can handle these people better. Thank you. Let me start. So here, what I'm trying to do is trying to articulate what are the various limitations in autourine therapy. And I have divided the limitations into two types of limitations. One is the unreal limitations, means they appear to be the limitation in effectiveness, but they are really not so. Okay. And then the real limitations, which I agree that they are limitations, and we'll go through them. Okay. So first and foremost limitations to the autourine therapy, which I have experienced, and most of you also may agree, are the soft aspect which are lying in ourselves, which are we ourselves lack the belief in autourine therapy. Let me tell you from my experience and also experience of many people, it is the belief in this system that works miracles. So any half-hearted attempt may not be a very good intervention measure. So Even the Hippocrates oath also talks like that, that we treat the body, but we console the mind. So most of the diseases are from the psychosomatic, and the belief is very important. We have been researching this topic a lot. And so the same thing holds good here also. We should get into auto-urine therapy with a strong belief that this is not urine, but it is medicine. Okay, so it is a very difficult task, and it is a good journey also for everybody, because the mental conditioning of treating urine as a disgusting material, waste material, has to slowly retreat in our mind, and then it has to replace with a feeling that urine is medicine. The moment we get a feeling that urine is medicine, then the belief will come back, will strongly be there in us. And this would, once the belief is there, there are the prejudices associated to urine and its therapy will also go down, and the individual resistance will also go down, and we experience many good benefits of that. Okay, so the failed experiences of somebody in our group, failed experiences may be for whatever reason which a person may be having internally in its administration or in belief, but that should not go and impact the efficacy of auto-urine therapy. Then the other type of limitations which we observe are process related or procedure related limitation. See, let me tell you from my experience and others as well, one of the foremost and most effective thing is drinking. Of course, topical application, there is external application helps, enema helps, all those things would help, but drinking is the most important protocol. Why? Most of us know that it heals from within in the sense it heals from the mind, it heals the body also. That's why drinking is the most important protocol in the whole thing. And here when I'm saying drinking, I always believe in fresh urine, not the old urine. Of course, we had many talks of old urine administration and all. Old urine good for tropical urine, but my theory here is it is very prone for, there's a risk for infection and kind of thing. So old urine, whatever the benefits we can get with the fresh urine, let us harness. Okay, and it is really nectar. Then the third type of limitations are a portrayed limitations. Means first is the individual limitation, second is the procedural limitations and issues we may inject, and third is the portrayed limitations. This is where we as a group have to work. We have to establish a very good strong advocacy network, and there are a lot of things to do here. There is so much of false information disguising as scientific information available in the public domain, which we have to counter, and then the real scientific literature has to come up. Then only these portrayed limitations that is the real unreal limitations would get off. Then the most important thing is the real limitations. Auto-urine therapy has got limitations, and I will explain what are those limitations. And because of those limitations, sometimes what happens is we get into a risk of jeopardizing our health, because we believe urine therapy will cure that, and then we will not seek a health care, and then the delayed health care will impact us very badly. Now, first I will go through the unreal limitations and then in detail, and then I will go through the real limitations. So unreal limitations, I call it as in Hindi Gnan Davana. So when the vested interest knows that there is a great therapy, there is a great protocol available, and through their vested interest, they have to suppress this. So how they do is they publish scientific articles which are skewed in two manners. Skewed in two manners in the sense they just blame the urine per se, and then the blame the protocol adopted by the urine therapy as unscientific. Through those two methods, the material and the method, both they blame. They find loopholes and then they blow that loopholes up. Then other thing is every scientific article has to be peer reviewed, and there is classic and there's a very clear failure in appropriate peer reviewing of the scientific or so-called scientific articles which would put blame on urine therapy. I will also show how it is. Then they make an outlier as a trend without analyzing the issues in the outlier. I will explain such trends also which I have seen in the scientific articles. And fresh scientific articles are published with very, very superficial data, and they are all called as anti-auto-urine therapy scientific articles. Because we know there's a huge amount of funding that is happening, and they are hell-bent on achieving these goals of skewed publication. So I'll take up this just to substantiate my claims. I will take a few articles where in one of these articles, I have given the reference also. They say that, the claims have been made that urine will treat these things. And they say that there are no scientific evidence to support any of these claims. And because in these articles, they make a blanket statement that they don't consider our patient's testimonial as scientific evidence, and they want to RCTs, random control clinical trials, on those things they want to do. We are not doing those things because of those limitations. They call auto-urine therapy administered protocols as unscientific in nature. Then other things they talk about is urine is not sterile. So they don't give any proper data. They make blanket statement that urine is not sterile and it is infected by bacteria. Okay, and most of the research articles that talk that urine is not sterile, they pick up very few case histories of very peculiar UTI patients, especially females, and makes the statements, and then they publish the articles, and then those articles become reference for some other articles claiming that urine is not sterile. So first somebody just inject a wrong hypothesis, and somebody else would make that hypothesis as a theory using a very false data set, and then a third set of people will refer to that and publish as a scientific article and try to make a false make a truth out of false through series of scientific articles, one pointing to the one, referring to the other referring to the other, where there is no substance in the first and foremost scientific articles. Like that, a fiction is made into a fact. And then other thing I was briefly talking is this: they claim, many scientific articles, so-called scientific articles, they claim that urine is not safe to drink because it has got bacteria, there are toxins introduced in that, and then there are risks to medication because the dosage would increase, all that stuff. In that, actually, the last one is a little bit true, that whenever somebody is into medication, they should not, they should be very careful, because the metabolism, when somebody is taking tablets, be it delayed release or sustained release kind of thing, it would impact the dosage. So there is some sort of truth, but they have disproportionately blown the untruth into that. So there are some emerging scientific evidence which clearly show that auto-urine therapy will relieve all the gastrointestinal problem, and then there is a normal creatinine, and there's no strain on kidneys, even if we are drinking whole amount of urine that has been passed out. So other thing they talk about is urine is dehydrating. And even I have also gone through that US field manual also says the soldiers should not drink their own urine even in a survival situation. Okay, so but all our experiences show otherwise. We have been doing urine only fasting without water also, and we don't feel any dehydration. Then other techniques they have been using is a few allopathic doctors have reported adverse event of urine therapy. See, they take up they take up one case study. For example, in this case study, a veterinary doctor injected urine through IV to himself. He is a pseudo doctor, and he injected urine for some Pramod Kumar waiting admit. So. So it led to very adverse event, and the same thing has been blown out of proportion in this article, saying that urine therapy leads to many adverse events. So the problem here is with the veterinary doctor without following a proper procedures and checks and balances. He has injected auto urine into his own bloodstream directly. Okay, and then there is one more where a dermatologist have reported old urine massage has gone wrong. So here is again a very specific case where the urine was infected because of the way it was kept or so, and then that is also a adolescent person who was administering massage to himself, but ultimately, it is from US actually. Ultimately, it is blown out of proportion, and they claim that old urine given for massage, it is not good because it is infectious. So then, of course, we talked about some of the projected limitations of auto urine therapy in the scientific ecosystem. And now let me, since we lost a lot of time, I will skip few slides, and now I will talk about some of the real limitations which are there. Okay, so for that I will have identified some of the risk factors, because auto urine therapy has to navigate through the risk factors. Ultimately, any healing is that way only. There are risk factors in the body, and then there is an administration of the medicine, and then the administration of the medicine has to navigate through the risk factors, and then the remedy emerges. So what are the risk factors? So one are there are three types of risk factors. First I can share is the modifiable behavioral risk factors, and then the second one, non-modifiable behavioral risk factors, and third are the metabolic risk factors. Okay, and this is very much as I mentioned, this is very much important for our lifestyle disorders. Not just lifestyle disorders, many of the non-communicable disorders. So what are the modifiable behavioral risk factors? We are abusing our body because of many ill habits, be it eating food habits, or be it tobacco, alcohol, or sedentary lifestyle. Sorry, somebody has question, then I think we can take those questions a little later. Okay, so those are some of the habits which a person is carrying with him. Then and we know, right, most of these will lead to many lifestyle disorders or non-communicable diseases, these risk factors. Then there are many non-modifiable risk factors. Let us keep it in mind. We are running against our age. Then there are particular race, gender, and genetics which we cannot modify at any point of time through any medical intervention. If my family is prone for diabetes, then be it so, kind of thing. You can't we can mitigate the risk factors, but if not, we can't fully get rid of it. Then there are, of course, the metabolic risk factors, which can be which are spin-offs of some of the non-modifiable risk factors. It can be the obesity, which is again due to modifiable behavioral risk factors or non-modifiable, whatever it is, obesity, blood pressure, glucose levels, cholesterol levels, all those things are the metabolic risk factors which are impacting us. Now, let us see how autourine therapy would address them. As I mentioned, the first two risk factor, autourine therapy may not at the outset, may not help. However, even in a bad habit, autourine therapy may work from inside out approach, and it can transform an individual from inside so that even those bad habits are alleviated. Okay, but that is an utopic world, and it takes a lot of time. However, we should keep it in mind that whatever the modifiable risk factors, if we can work on that, then autourine therapy would be very much beneficial. On the other hand, if we have that bad lifestyle and then administering autourine therapy, and then we should not blame autourine therapy if we have not got desired results. Okay, and as I mentioned, one of the other most important thing is administration of yoga and pranayama as an assisted protocol for autourine therapy, because they're proven to be very effective in tackling metabolic risk factors. Because, for example, I think here where some of our Ayurvedic people can also help us out. For example, if the tridosha is not balanced, then to balance the tridosha with autourine therapy, it may take more time. But if we use some sort of medication like Triphala Churna or along with our yoga and pranayama, then our benefit realization from urine therapy may be fast. In fact, this is what even I also experienced. I added Triphala Churna into my routine, and then that gave me very good beneficial results in balancing the doshas. And as I mentioned, the yoga and pranayama also benefited a lot. So summary of this slide is, there is a risk factor associated. We should understand the risk factor. We can't abuse our body with our bad habits and claim that autourine therapy is not working or its effectiveness is less. So we should work on those risk factors, and to get better benefit, if we are, we should have some sort of Ayurvedic assessment also. And if we feel that we are very much Pitta Prakriti or very much Vata Prakriti or whatever it is, then some Shodhana and Panchakarma therapy periodical may be very beneficial, and it would increase the effectiveness of autourine therapy to a great extent. So this calls for some sort of integrated intervention. So, having understood all these risk factors, once we tackle them intelligently, we can say that our urine is not just curing our illness, but as I mentioned, it is transforming us inside out. Even though we have some addictions, it would through mind some sort of rewiring our brain, it would transform ourselves, and it has also been helpful in many mental disorders. So net, it is a spiritual practice than medical practice. Okay, so these are some of the points which I had already talked in my previous session, and I stopped here. And now let me go through a few more additional topics. Okay, so how we have to take this urine therapy to the masses very effectively. Okay. So for this, I think these are all, I'm just sharing my thoughts here. I think we should have a very strong, of course, this platform is a achieving that, and we should have a very close coordination between thought leaders of autoimmune therapy, and then we should establish some sort of evidence-based protocols for individual therapies. For example, I think I was talking about this with Bapatji also. We have to address few, health burden issues. For example, be it kidney dialysis, be it cancer. In fact, I was talking to Bapat about the cancer stuff, and then with dialysis, I was talking to somebody else. So dialysis, these days, there is so much of load on the health ecosystem, and we are pretty sure autoimmune therapy would reduce the load on the dialysis of the patient. So we should come together, establish a protocol for dialysis, establish a protocol for cancer, talk to the people. Now there are camps happening in the dialysis, camps happening, free dialysis camps happening in the metros, where every day some 20-25 people come to that hospitals. And I think we need to talk to them, try to motivate them to consider autoimmune therapy as one of the potential intervention for themselves. So working with the patients for a disease specific protocol is one thing. And second thing is, of course, we have to develop more and more practitioners. And we need to have that realistic practitioners, as I mentioned, because understanding the risk factors, understanding the stigma in the society is very important in getting good results. So having done these two, our focus on developing new scientific literature can't be undone. We have to focus on the scientific literature. We have to publish them. Then, for example, whatever we have been hearing 30 years back, we can't hear the same narrative another 20 years later now. We have to have a better published data coming out. And we should all note that patients' testimonials are not scientific evidence. So we need to create metadata from that, and probably through that scientific literatures can be published. But so far we have been focusing on the testimonials, which are more of emotional oriented, and that's why it may not suit the bill of scientific literature. On the other hand, what we have to do is we have to have a very strong quality of life parameters, and we have to develop some sort of index for that and establish a quality of life based effectiveness study for autourine therapy effectiveness. Like that, we have to brainstorm in the days to come. For example, we can talk on one Monday specifically about quality of life parameters, or some other topics, how to develop a scientific literature or how to develop practitioners. Like that, we have to take up individual threads and discuss in this group and take it forward. So overall, I feel there is a need for a center of excellence, because mostly the center of excellence are sponsored by government, and without any center of excellence, any system of medicine will not be able to develop its full potentiality. And autoimmune therapy, of course, some may agree, some may not agree. It has still not received state's sponsorship. It has not received, that agreement from the state. So we have to establish some sort of center of excellence ourselves, and then we have, through that umbrella of center of excellence, we have to do this coordinated efforts through all the working groups. I think if we follow this process, I think in the years to come, we can have better penetration of autoimmune therapy across, in not just in India, in the international forum as well. So this is what I was talking about, is establishing a center of excellence. The center of excellence would take autourine therapy as revolution to the masses, because we know that it is so much of painful to understand the cancer story. It pains so much to understand the kidney dialysis issue, and we are pretty sure, we know that kidney dialysis, the CKD, chronic kidney disease, it can be very effectively cured through autourine therapy. So we have to probably work on such areas under the umbrella of COE, and establish the treatment protocols. This would also help the research publications by giving more and more evidence. Okay, so these are some of the additional points I wanted to share with all of you about Center of Excellence. Okay, so and I think, yes, Tiwari, correct. So what we have to do is we have to visualize what Center of Excellence has to do. It has to be all the thought leaders have to come and join in that. And more than the physical location, it is coming and working for the sake of
recording stopped.
Okay, so we don't have a great vision for that autourine therapy, and as I mentioned, it that itself is a separate topic which we have to deep dive.
Recording in progress.
We have to deep dive into how to establish a COE, what are those objectives, who are the people to be involved, the organization structure, all those things we have to work out. And we have to also have a scientific journal from the COE established under ISBN. Okay, those points are missed out in the slide. So I think once we get into such trajectory, I think in next maybe in 1 or 2 decades, I think we can say that for example, Ayush, the U stands for Unani as well as urine. Okay, the government will definitely buy in, and it is our responsibility to do all these things. See, so far what we have been doing is, let me tell you, we have been doing it in a piecemeal manner, like using some testimonies, using our exam experiences, or loads of testimonies together and sending it to government, and also very much relying on our former Prime Minister Morarji Desai's statements. Okay, so such personal propaganda may not be very effective in getting a state sponsorship, especially for a country like us in 1.4 billion population. We have to, my point of view here is, we have to address disease by disease, attack few disease with autourine therapy, establish establish a strong coordination with charitable hospitals. Okay, because in Bangalore, which I am working, there are some 2 charitable hospitals. There's Mysore Agarbattis is running a 25-bed dialysis center in Bangalore West, and there's one more dialysis center in Bangalore South with 60-bedded centers. So every day there will be some 30 people coming, and I think we need to have some sort of see, for this we should not go in a single person. We need to have that COE, and then that COE has to handle such things. That is my point of view here. Then what happens is, when we have institutionalized that protocol administration mechanism, there will be very good buy-in in the society. And also it all has to be an evidence-based medicine and evidence-based administration, so that we have to capture evidence in periodic intervals, and then that would generate scientific evidence. Okay, so that is just one example I gave, that kidney dialysis. The same thing has to be done for cancer also, because there are many memorial hospitals, charitable institutions, and I feel there will be some doctors who would be very much genuine doctors, who would be accommodative in autourine therapy therapists to go there and start advocating these things. because they are charitable institution. They won't get any, they don't have any vested interests in that. Okay. And once we get access to patients in masses, and we are able to convince patients, especially in stage 3 and 4, I think next is the patients themselves will give us the data. Okay. So this is what about it? My rendition today. First is, as I mentioned, the limitations of auto-urine therapy, the so-called limitations, which we all have to work and get rid of that, or we have to debunk that limitations of auto-urine therapy. And then the second phase is the real limitations of auto-urine therapy, the risk factors, which the individuals have to work, and also as a group we have to work. And then the third is establishing a center of excellence for auto-urine therapy in India, where we should have the goals of reaching out, patient outreach, reaching out to patients of, to begin with 2 or 3 types of diseases, generate more scientific data, and then that's how the stigma in the society will also go away. So on these 3 pillars, I have delivered my speech today. So now I think let me open the forum for the questions. So 2 type of questions. I think there may be many individuals who wants to get answers about their medical conditions. I think that we will also discuss. And also, if there are thought leaders talking about the COE approach and kind of things, that also we will talk. Okay, so 2 types of questions we can take up.
Hello.
Yes, please.
So you have mentioned about the charitable hospitals doing the dialysis. The dialysis is according to
Recording stopped.
the dialysis is done because the kidneys are not working. But the byproduct of dialysis will be the urine, no? If that urine
Recording
again
in
used
progress.
for the patient, will it help by just massaging any of that material and even injections? Will that help in the patient of dialysis? Because the byproduct of dialysis is the urine itself. That is what my contention is.
Exactly correct, sir. So the key here is internal administration of urine. Okay, and I think I am not a first I would give, if there are any doctors who have administered CKD patients, probably Nitin Bhai or somebody else who is in this call, if they can share their experiences on how autourine therapy can help dialysis patients first, and then we can talk. I will add to that.
The kidneys are failure, no? The machine is
CKD,
taken.
sir, as far as my knowledge goes, CKD, it is not a total failure of kidney. Okay. So of the 2 kidneys, one is probably 80-90% is failed, and other kidney is 30-40% is failed. That's how, they need assistance of dialysis. Okay. So
Okay.
in dialysis patients, the objective would be to reduce that CKD, that is extent of the kidney disease, from 80-90% to, even if it comes to 30-40%, then the frequency of dialysis will reduce, and also their quality of life would improve. Okay, so this is the hypothesis with which we have to start, and then we have to also first and foremost is patients themselves will be very much averse to drink their urine, because they feel that by drinking urine they're putting load on the kidney which is already diseased. Right, because they are going to dialysis to get the urine out of their body, and now we are telling them to drink urine. Okay, so that itself is a very difficult proposition for them to digest.
Drink urine. Drink urine. The machine is there. No, it is already working. The same thing will go in the blood, and that machine will also take out if it is harmful to the kidney, isn't it?
No,
Right.
sir, it is
I am
not.
not expert. I am just was thinking that if the byproduct of the dialysis is like a urine,
Mhm.
can we not use the urine that as urine for the patient by various made system? We may massage his body, we may give him enema, we may inject it.
Sir, other methods, I don't have anything, okay, about your enema, massage, all that stuff. But what I am primarily focusing on is drinking for CKD patients. Okay. And for this as a starting measure, I want some strong case studies from doctors who are already treating CKD people,
Okay,
or
okay, okay.
patients who have cured CKD. For example, I think we already have, I think, some 10, 15 good testimonials in this. Okay, we have to base our first initial exploration through those testimonials and take it forward.
Okay, okay. Yeah.
And
Thank you.
also while selecting patients, we have to definitely take two type of patients. One is the patients who are in the preliminary stage of CKD, or preliminary and mid stage of CKD, and who are completely getting into that kidney transplantation. Because
Okay.
after so much of dialysis, it will lead to kidney transplantation requirement only. Okay. So if,
Excuse me, sir.
yes,
Here we can use healthy person's urine in relation with that person, no? Healthy person's
see,
urine.
See, this is this whatever you mentioned. This is a common factor for in all the things, be it in urine, UTI, or in any place where the urine has issue. Then we can take up two things. One is the cow urine or other healthy person's urine. Those are a common answers common protocols which you can always adopt. But nothing like one urine, even if it is infected. This is what many people say. Okay, of course, these are all, as I mentioned, these are all options in front of us. And as I mentioned, only in future, when we administer those options to patients, we get a very good optimum answer.
Arey wah. Nitin Patil, please.
Dr. Naveen ji, we have the same question in our last national conference, and there are many kidney patients were cured by Narayanan ji, and that was discussed there. That Dr. Nitin Patil told that to those who does not drink urine, that is only kidney patients, like that he mentioned the statement. At the time, Narayan Mash interfered
Yes,
and told
correct.
that many kidney patients were cured in Kerala.
Yes.
So we
I
have in
remember
Kerala,
that.
we have so many kidney patients cured by urine
I
therapy.
remember that. So
Yes.
in fact, those optimistic, or those case studies are our I should say a stepping stone when we have to take it in a national level. Because we all know, right? We all know urine is very effective in curing kidneys first, and kidney disease are very rampant these days. So we have problem in one hand and solution in the other hand. Yeah. Next question.
Yes. I'm Dr. Nitin speaking here.
Hello, sir.
And
Hello,
good evening
doctor.
to all, and namaskaram to everybody, especially Naveen
Vanakkam.
sir. You are in a new look. Actually,
Yes, sir. Yes, sir.
yeah.
Thank you.
So
Thank you.
after the Kerala conference, we had a very good times together.
Yeah.
We went to Kanyakumari and all. We discussed many things. As you were, whatever points you spoke of in this particular meeting, I really agree with that. The center of excellence factor, which is very, very important. Now, this initiative taken by this all this Basumaji and Rajaramji is very good. Now we are discussing many things, like as you have mentioned about the need of a research best evidences. As you rightly said, that only patient testimonies cannot be counted as a research evidence. So what we need to do is we have to come on one platform as in our institution, as my father was a urine therapy practitioner, and he was associated with Moraji Bhai Desai. So we have many patients now in Anand Kunj. Every week we cater around 30 to 40 patients, 30 patients, minimum 30 patients we are catering, and they are exclusively coming for a urine therapy. There are certain kinds of patients like from diabetes to cancer, obesity, from common cold to many dreadful diseases we are treating. But what is happening is, as you said, that there is a need of a research, and as we both brothers, we are only working here. It's a teamwork basically. What is and now this online classes are going on. This now whole globe is on one platform. So virtually we can come together, and we have to make one platform. We can make one team, and with that team, what we can do is, suppose somebody is a microbiologist, somebody is from a biochemistry department, somebody from a pathology department, and we have to assign certain things to them. Okay, they have to come to every day. They have to collect the data. Some software engineers also can help us to make it more presentable, and that data we have to collect together, and then we can go for a what you say is a center of excellence, and we can work together. That's what I feel. And regarding the CKD treatment, CKD problem, that is chronic kidney diseases, there are many patients in initial part of our institution, like in 70s, 80s, in 90s. As a child, I have seen many kidney patients, as my father was able to treat them. But what we have seen is, if the urea creatinine level, once it goes beyond 5, before 5, we can little bit, in certain patients we have got to found a good results. But after 5, what we have seen is, if they consume self urine, the urea creatinine level goes up, and that again creates a big problem. Patient has to go for a dialysis and all that. That's what we are seeing now. Mr. Narayanji from Kerala, he claimed that there are certain patients who have been successfully treated with the help of urine therapy. I would like to certainly look into those patients. I would like to have that data. I would like to see what are the treatments given, what were their presenting complaints, and what were their reports. And certainly we would look forward, because this is the only what we have seen is kidney patient, as well as there is a one this particularly this, once the blood CPK value, especially in a childhood muscular dystrophy patient, there also we didn't find any results. So these are the two diseases, muscular dystrophy and then this kidney failure patient. We couldn't find any results at Anand Kunj especially. Some people got result, as I said, that before their creatinine is less than 5, we found the results. But I doubt, sometimes we give them sublingual doses. We don't allow them to drink a lot of urine. We gave them some naturopathic modalities. So in that, whether that worked or urine therapy worked, we don't know that. Okay, so what we say is, these are the two particular diseases we didn't find any results. Whereas in other all the diseases, we got a very good results. We have a record of that. Okay, so as you said, again, it's a teamwork. It's a research we have to put forward. So it was a very good altogether. It was your presentation was very good. I really feel great to listen to you, and I'm seeing you in a new look. Thank you very much. Yes.
Thanks, doctor. So
thank you. Thank you.
So just to extend your points, Nitin sir. So you were really nice to have your thoughts on COE and your concurrence on establishing a COE. And because it is like once we start the COE, all the things will fall in place, because there will be a scientific committee established there, and then there will be an advisory committee established there which will advise about the protocols. Something will happen for the collecting scientific literature, and also it is not that only for
Recording
the new
stopped.
even for the past ones. For example, all the scientific records in Anand Kunj may have to be digitized or kind of thing, something organized systematically,
Recording
and
in recording
it could be
stopped.
made as publication worthy. I think we talked about this at Kanyakumari also, you and me.
Yeah.
Has to be initiated those things. So the
Recording
COE
in progress.
again I will talk about COE sometime after a few weeks in the same forum. When I get time, probably I will make a more thoughts, and basically articulate that in a more understandable manner, so that it can get into execution mode soon after that. Okay.
Yes. Certainly.
In this at this stage, I wanted to seed basically plant the seed of thoughts in all of us, that there is a need for the center of excellence. Okay, I think that has been done now.
Yes. Yes.
And about the CKD
Any
thing,
questions?
and about the CKD thing, Doctor. So I think whatever you mentioned and what hypothesis which even I had also is matching. Means of course there will be always difficult cases, very hard nut to crack. Let us not attack them in the beginning itself. But however, when the creatinine and urea or those parameters goes increasing, say creatinine greater than 2, that is the early signs of kidney diseases. And that is where once we address such a patient group itself, it will be very beneficial for them to bring the biochemical parameters down. Okay. Yeah. And also on the other side, there will be many people who for whom dialysis has reached a stage which is not improving their quality of life, and they can't get kidney. So we should identify such patient group also, even if a 10 group, and then of course after the ethics committee clearance, of course for all these things COE has to be there. Ethics committee clearance, we should be able to, okay, pilo bhai kya hota hai dekh lenge.
Yes.
Right.
Yes. And furthermore, what we need to do is, there are many patients. Once they get cured, they will be in contact with for 1 month or 2 months or 3 months, maximum up to 6 months, and then later on we forget them. Okay, so what is required is the maintenance of their record.
Correct.
Okay, and that record we have to maintain them. Sometimes those patients, they are not ready for again going for any pathological tests or some other tests. They are not ready because they say that I'm got all right and doesn't want to go to any further tests. So we should have such a platform. There are many patients, they doesn't want to spend any money on themselves sometimes. So we have to establish certain funds also, so that on behalf of Urine Therapy Federation or this union, we have to spend sometimes for the making a case study. So sometimes we have to spend from our pocket so that we get a research based evidence of that particular patient.
Yes.
Sometimes, so that's what, so much of fund requirement is there. Once you have to go for a research, then we require a lot of funds. And generally in other faculties, government gives so much of funds, then only such a type of institutional based research we can do. Okay, so for that we need fund. So for that government has to support this cause. Then only we will be able to do that. Otherwise, private institutions, it will be very difficult. That's what I feel. Yeah.
Absolutely correct, Doctor. See, one is I had some thoughts on that actually made. I had not put in the slide. That is for my next presentation. The patient outreach, which I just hinted, is precisely this. For this patient outreach, our backbone is a strong IT solution. IT
Yeah.
solution, the moment a patient's data is entered, periodically we need to get the data updated, and we need to have a very good quality of life questionnaire established, so that even after 2 years, even if it's a fever or some very small issues they might have faced, we should we should have a baseline quality of life, and then we should compare that after X number of days or years, so that a patient is always in touch with us. Okay,
Yes.
that we will establish those things. And again, coming to this funding, yes, funding is a common pinching factor everywhere. But I think at this stage, let us not worry about funding. Let us just look at our ideas, ideas, and I think if the ideas are good, funding will definitely come.
Yes.
There.
Yes.
Okay.
Yes.
With that assumption, I think let us go ahead.
Yes.
Sir, I have one question.
Hello.
Yes, madam.
Yeah, whatever any doctor tell me, please. It's a long time I asked for that pancreas cancer. It's my one of the patient. So which is it?
Pancreatic cancer.
Yeah.
Anybody? Please.
Yeah,
Sound is
Nitin
not
Patel sir and hello.
Your sound is not clear. What you said? Pancreatic cancer?
Pancreas cancer.
Yeah. Yeah. Who is having that?
40, one of the patient, he is 40 years old.
Yeah. Okay.
Yeah, so what to do? I don't know about cancer actually. That is why I'm asking you.
See, Purvi, we need to know rest all the things like how much is the weight, since how long he has been suffering with the pancreatic cancer.
It's a 1 month ago, sir.
Yeah. And what is his age?
50.
50. Yes, there are many patients we have treated with this pancreatic cancer. Okay, we have to, in certain patients, their blood sugar level goes up and down. In certain patients, it doesn't affect also. So we have to see the present condition, and accordingly we can suggest urine therapy for him. Okay. See, for cancer patients, what I'll say is only urine therapy is the hope. There is no any hope, any other methodology through which he can get cured.
That so I know, but what I'm giving the treatment, what to do, but I want to give the treatment. So what I suggest that patient?
We have to put him on a fasting. Okay. By looking at the physical condition. Okay. How much is the weight and all that. If that person is stout and sturdy, then we can put him on a fasting. So urine fasting will help.
Urine fasting.
Yes. Yeah, urine fasting. He has to drink all his urine throughout the day. He have to massage with the old matured urine, 7-8 days minimum old urine, every day sun bath, and after that everyday massage we have to give. In certain cases we need to give some urine enemas also.
And so enema for twice a day or weekly?
Twice a day, morning, evening, you can give urine during a fasting period, and after the fasting, put him on a totally raw natural diet. Okay, all the juices. So for 3 months, he has to follow that.
Yeah. Okay, sir. And so I want to ask. I want that lavajam, that Shivambu lavajam too. I have no any address for Kolhapur Hospital, Anand Kunj. So please, Pasumasa Nitin, so please mention your address, please. I want that Shivambu Parivar map.
Yes. I'll put that. That.
Yeah, sir. Thank you.
So, Purviji.
Yeah. Yes, sir.
A couple of points I wanted to add here. Okay.
Yeah.
Probably you can add some urine patti. Okay.
Yes.
Urine patti on because it is pancreatic cancer, that may be helpful. And most importantly, in pancreatic cancer, I go with an idea you can actually experiment with yoga. especially the Mandukasana yoga. Okay, you can just
Yeah, that I know.
Mandukasana yoga may be very beneficial, and bandhas of Uddiyana bandha would be very, very beneficial for pancreatic cancer, and then followed by Kapalabhati also. So you please, if the patient can, since he's 40 years of age and this pancreatic cancer is just a new thing, okay, it would be definitely beneficial with autourine therapy. Okay, please
Thank you, sir.
add
Yeah, thank
these
you, sir.
three.
Thank you.
Yeah, these three. And also please note that even, of course, pancreatic cancer is a later stage, but they get all these GI issues or pancreatitis. There also such addition along with autourine therapy would be very useful.